So going back to the somites, already you know what I have described on the last part of the last class, that the somites, cervical 8, thoracic lumbar, thoracic 12, lumbar 5, sacral 5 and coccygeal 8 to 10. All somites are now segmented by two parts, dermomyotome and a sclerotome. Dermomyotome again has got two parts, dermatome and myotome. Dermatome produce the dermis of the skin and myotome produce the skeletal muscles of the axial, means body, trunk, abdomen, skeletal muscles of the body as well as our extremities. And myotome produce the skeletal muscles, skeletal muscles of our axial structure, that means the thorax and abdomen only. Sclerotome produce the vertebra and the ribs, right? Next. But I have already told you, these are segmented definite cubes, but there are certain somites, most cranial parts, they are not properly segmented. We call pre-occipital somites and occipital somites. Pre-occipital somites are 3 in number and occipital somites are 4 in number. Truly speaking, we must call not somites but somatomeres, because they are not producing definite cubical block. But loosely we call pre-occipital somites 3, occipital somites 4. What structures develop from them? From the pre-occipital somites develop the muscles mainly of the extraocular muscles. You know, in the eyeball, we move the eyeball in different directions. For needs the muscular activity. The muscles are there, which moves the eyeball above, below, laterally, medially, which are called extraocular muscles, superior oblique muscle, inferior oblique muscle, lateral rectus muscle, medial rectus muscle, superior rectus, inferior rectus. These are called extraocular muscles, and from the pre-occipital somites, these extraocular muscles are formed. And from the occipital somites, the muscles, skeletal muscles of the tongue are formed except palatoglossus. Skeletal muscles of mainly the tongue are formed from the occipital somites. You can tell that, sir, the somites are on the backside structure, on the dorsal side, but tongue is the ventral side. Then how the tongue should be there? No. Actually, these muscles, these occipital somites migrates means moves in this fashion to come to lie inside the tongue. That will be dealt in your embryology of the tongue. I am not going into different details. So, these are all about the history of the somites and somatomeres. Next, and importance, what is the other importance of the somites? We can determine the age of the fetus, embryo, by the development of the somites. If you find only 1 to 3 somites in an embryo by some, then you can say the age of the embryo is 20 to 21 days. Suppose you find 5 to 6, because every day 3 somites are produced, you can say the age of the embryo is 22 to 23. In this way, you can, for example, we can say, I have already told you, the neural tube that is formed, it is a closed tube, but there is an opening most cranially and most dorsally. Bolechilam to, the neural tube hocche, but there is an opening cranially and dorsally. We call neuropore, anterior neuropore, but cranial neuropore and caudal neuropore. Cranial neuropore closes at 25 somite stage. Mane ki holo? If we say cranial neuropore closes at 25 somite stage, what does it mean? The age of the embryo then 25 somites? কত হবে? 20 somite stage cranial neuropores closes. So what is the age of the embryo when this cranial neuropore closes? কে বলবে? তাহলে 23 to 24 days. 21 25th হয়েছে, 1 to 3 in 20th day বা 21st day, তাহলে হলো 3 to 4 কত হলো? তাহলে 25 সময় স্টেজ কখন আসে? 20 সময় স্টেজ, সরি নট 25, 20 সময় স্টেজে ক্লোজ হয়। তাহলে 20 সময় স্টেজ কখন হলো? এজ অফ দ্য এমব্রিও হিসাব করো। 25-26 days, 25 days। এরকম ভাবে আমরা এজ ডিটারমিন করতে পারি। সাপোজ ইফ উই ফাইন্ড এ এমব্রিও where there is a mass of paraxial mesoderm but no somite formation, we call it pre-somite period, and after 30 days we call it post-somite period. In this way the somite is also important for determination of the age of the embryo, right? Next is the intermediate cell mass. Here only 1 or 2 lines. Details will be on your special embryology classes. From the intermediate cell mesoderm, the urinary system, part of the urinary system and genital system, duct of the genital system develop. For example, part of the kidney, ureter, part of the kidney develop, testis, ovary develop, and also duct of the genital glands also develop from this intermediate cell mass. So genitourinary system develop from mesoderm, from the intermediate cell mass. Finished. Arnoy. Next, that is the lateral plate mesoderm. Previously it was a solid. There is a no gap, no cavity. This is the ectoderm, this is the endoderm. Then a cavity will appear within the lateral plate mesoderm. Within the lateral plate mesoderm, a cavity will appear, one on either side of the lateral plate mesoderm, right? We call it intraembryonic coelom. We call it intraembryonic coelom, which splits the lateral plate mesoderm into 2 parts, one dorsally, one ventrally. This cavity splits the lateral plate mesoderm, one dorsally, one ventrally. The dorsal part, dorsal sheet, better to say it is a sheet-like. In cut section it looks like that, but actually it looks like that, sheet-like. So dorsal sheet of intraembryonic mesoderm we called somatopleuric layer of the intraembryonic mesoderm, and the ventral sheet of mesoderm we call it Splanchnopleuric layer of the intraembryonic mesoderm. And this coelom or cavity, ultimately anteriorly it will be continuous with the pericardial cavity, which is developed cranial to the preotic capsule. Ultimately whole cavity is continuous with each other and ultimately form the peritoneal cavity, pleural cavity and pericardial cavity. What is that? Actually, just one or two lines. This is the thorax, this is the abdomen. Heart is there, lungs is there. Diaphragm and stomach, intestine are there. This is the abdomen. All these heart, lungs, etc. are covered by a membrane. We call it peritoneal membrane. What is it? You just imagine a balloon, gaseous balloon. Suppose this is the balloon. খুব ভালো করে বোঝো। Suppose this is the balloon, right? So this is the cavity, this is the wall of the balloon, this handkerchief, this is the cavity, it is closed on all sides. So this is the balloon. This is the stomach. This is the stomach. Now gradually stomach invaginates within this balloon. একটা বেলুনের মধ্যে তুমি হাত ঢোকাচ্ছ, ফিসটা ঢোকাচ্ছ, একটা বেলুন ফুলে আছে তার মধ্যে ঢোকাচ্ছ, তাহলে কি হবে? তাই তো, বেলুনটা ঢুকে গেল, বেলুনের মধ্যে ক্যাভিটিটা ঢুকে গেছে। বাট অ্যাকচুয়ালি ক্যাভিটির মধ্যে কি বেলুন এই ডাস্টারটা রয়েছে? নো, ডাস্টারটা কিন্তু ক্যাভিটির মধ্যে নেই। দেখো মনে হচ্ছে বাইরে থেকে, ইফ ইট ইজ এ ট্রান্সপারেন্ট, সাপোজ ইট ইজ এ ট্রান্সপারেন্ট লেয়ার, if you see from outside you can think that the duster is within this cavity, but actually it doesn't. Duster is not within the cavity. We cannot touch the duster because there is a layer there, the layer of the handkerchief. So, and this is the peritoneal cavity. This is the peritoneal cavity here. Right? This is the splitted, above it is the somatopleuric, below means ventral to the, this is the cavity, and the stomach is invasited, heart is invasited like that. So that we can call, and this is the peritoneal membrane. In case of a heart, we call it pericardial membrane. But within the cavity there is nothing, only few cc of fluid, few cubic centimeter of fluid are present, few milliliter of fluid are present. We call them peritoneal fluid. So with this process where in the balloon you push the fist inside, the process is called invagination. The stomach is invaginated, heart is invaginated, lung is invaginated within this. Accordingly, stomach is invaginated within the peritoneal cavity, heart is invaginated within the pericardial cavity, lungs is invaginated within the pleural cavity. Actually, all cavities are initially continuous with one another, but gradually the septum develops, separate them into different cavities. So this is the intraembryonic coelom, ultimately produce the pericardial cavity, pleural cavity and the peritoneal cavity. And the layer which completely covers and attached, closely adherent to this viscera, we call it visceral layer of this pericardium cavity, pericardium, visceral layer in case of a lungs, visceral layer of the pleura, in case of a stomach, visceral layer of the peritoneum or visceral layer of the stomach. And this layer we call the visceral layer, ভুলে গেল, আচ্ছা যাকে পরে মনে পড়বে, হ্যাঁ, the visceral layer of the pericardium. So in this intraembryonic coelom ultimately produce this peritoneal cavity, pleural cavity and the pericardial cavity, right? শিখলাম, এটাই হচ্ছে intraembryonic coelom. Next, so to sum up how intraembryonic coelom is developed, it is depicted in this slide. Oh, look, again small cavities appear within this lateral plate mesoderm. Ultimately they join together to form the large cavity. From the recapitulation again, from the intermediate cell mass, ওই লেয়ারটাকে বলা হয় প্যারাইটাল লেয়ার, লিখেছিলাম, প্যারাইটাল লেয়ার of the pericardium, parietal layer of the pleural cavity, parietal layer of the peritoneum, and they are closely adherent, তাকে বলে visceral layer. Next, intermediate mesoderm. The intermediate mesoderm generates the urogenital system part, the kidneys, the gonads and their respective duct system. Finish এখন আজকের মতো. This is the lateral plate mesoderm, cavity appear. আচ্ছা এরপরে ওটা কি করে পরে বলবো. And this so what I have already told you, this is the intraembryonic coelom, this is the somatopleuric layer, this is the splanchnopleuric layer. The splanchnopleuric layer is closely applied to the which layer? Eta kon layer? Ectoderm, mesoderm or endoderm? Endoderm. Ultimately this is the yolk sac, and this part of the yolk sac will produce, I have already told you, gut, GI system, and from the GI system part of the respiratory system also develop. So this I have already told you, this layer only form the lining epithelium. Then who will develop the muscles? Who will produce the muscles of the stomach? Who will produce the muscle of the intestine? This layer. Splanchno means viscera. This visceral layer will produce the muscle of the GI respiratory system. This is the splanchnopleuric layer of mesoderm. And look, it is the all-round view looking from the dorsal side. This is the intraembryonic coelom. This is continuous with the pericardial cavity. This part will develop the peritoneum, this part will develop the pleura, and this part will develop the pericardium. Now, another important and difficult to understand, but you, more or less you have an idea, the most important part of this, the last part of the general anatomy, that is the foldings of the embryo. Is he or she look like a disc? As long as I have called it is an embryonic disc. The embryo is look like that. Initially, totally circular. Gradually, cloacal membrane, primitive node, notochord, side হেরে যাচ্ছে, buccopharyngeal membrane, notochord, primitive node, primitive streak, cloacal membrane, and this is the cell mass. But are we look like that, like a disc, oval disc? No. We are more or less cylindrical, round structure. How it is possible? And what I have told you, if it is the scenario, the liver will be and the diaphragm will be there, followed by the heart, then the mouth. It is not like that. Brain is above, then there is a mouth, then there is an heart. How it is possible? Because initially you look like that. It is possible due to folding. Suppose, why there isn't folding? Because in the disc, the cell proliferates. Proliferates means mitotic division occurs. More cells are produced. We call it proliferation. The cell proliferates, but the central cells are proliferates more than the peripheral cells. The cells of the central area of the embryonic disc proliferates, mitotic activity more cells are produced than the peripheral area, so that it becomes folded on all sides, and cranially, caudally and laterally. So folding occurs due to excessive proliferation of the central cells of the embryonic disc. The oval disc now be showing a cranial fold, we call it head fold. A caudal fold, we call it tail fold. And on the two sides, two lateral folds. And all folds ultimately joined at the level of the umbilicus. So head fold, tail fold, two lateral folds, one on either side. What affects due to head fold? Most important due to head and tail fold, the inclusion of the part of the yolk sac within the embryo. How it is possible? This is the epiblast cell, ectoderm. This is the amniotic cell. This is the endodermal cell, produce the yolk sac, right? Transverse section, middle line. Epiblast, hypoblast, yolk sac, amniotic sac. Now, ultimately it produces the ectoderm, endoderm and middle mesoderm, whatever it may be. Then there occurs folding. Edike. Then there occurs folding. Right? আমরা এবার ট্রান্সভার্স না হয়ে আমরা ইলিপ্টিক্যাল মানে আমরা এরকম ভাবে দেখছি এমব্রায়োটাকে, ডিস্কটাকে। আমরা ডিস্কটাকে এরকম ভাবে দেখছি। Notochord, head end, primitive streak, cloacal membrane. এরকম ভাবে কেটেছি। কেমন? cranial side, ও head side, caudal বা tail side. এটা midline section. এইখানটায় শুধু মেসোডার্ম রয়েছে, এই জায়গাটায়, ওই যে। এবার ডিউ টু ফোল্ডিং, এইবার যে ফোল্ডিং হয়েছে তার ফলে কি হয়েছে? এই একটা ফোল্ড হয়েছে। Equally, a part of the yolk sac is taken within the yolk sac ফোল্ডের মধ্যে ঢুকে গেছে। এই ফোল্ড হয়েছে, এই ফোল্ড হয়েছে, তার ফলে কি হয়েছে, এইটা এরকম হয়েছে, এইটা এরকম হয়েছে, ফলে কি হয়েছে, এ পার্ট অফ দ্য ইয়ক স্যাক ঢুকে গেছে, গেছে তো, ফোল্ডের মধ্যে ঢুকে গেছে, আমরা বলি ইনকর্পোরেটেড। সো এ পার্ট অফ দ্য ইয়ক স্যাক, a dorsal part of the yolk sac is incorporated within the folding. This part will produce the GI system and part respiratory system, mainly GI system, gut. এই পার্টটা, and this part will remain outside the embryonic area in the, এই জায়গাটায় রয়েছে কানেকটিং স্টক, এই কানেকটিং স্টকে রয়েছে, এখানটাতে কানেকটিং স্টক, এইটা হচ্ছে কানেকটিং স্টক, এর মধ্যে রয়েছে। ইনিশিয়ালি it is the same yolk sac. A part is incorporated within the embryo due to folding, mainly head fold and tail fold, and a part remain outside, connected by a wide channel, connected by a wide channel. This part of the yolk sac which is incorporated, which is entered within the embryo, we call primitive gut. Primitive gut, esophagus, stomach, intestine, etc. And this part, we outside, the remaining part of the yolk sac ultimately becomes smaller, 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 produce the definitive yolk sac, and we call it umbilical vesicle. Umbilical vesicle, and the channel which is initially become wider, become very narrow, and we call it vitalo-intestinal duct. তাহলে এটা কি হবে, ultimately, and this part which is incorporated within the yolk sac become elongated craniocaudally, লম্বা লম্বি বেড়ে যাবে, বুঝতে পেরেছো? প্রথমে একটুখানি গোল টাইপের হয়েছিল, দেন দিস পার্ট, ডিউ টু গ্রোথ অফ দ্য এমব্রিও, দিস পার্ট, ইনকর্পোরেটেড পার্ট অফ দ্য ইয়ক স্যাক অলসো গ্রোজ লেন্থ ওয়াইজ। তাহলে কি দেখতে হবে, আমরা কিরম তখন দেখতে হলাম, এই যে গাঁটটা ultimately become elongated and produce the gut. This is the umbilical vesicle, very small, and this is the vitalo-intestinal duct. And all these structure, ultimately this is produce the umbilical cord. So the vitalo-intestinal duct, allantois and umbilical vesicle are all remain within the connecting stalk, ultimately which produce the umbilical cord. এখন ছেড়ে দাও ওটা। তাহলে আমরা কি দেখলাম, gut becomes incorporated, a primary yolk sac become incorporated, a part of the gut which is incorporated, part of the yolk sac which is incorporated within the gut, we call it the primitive yolk sac, which is connected to the remaining part of the yolk sac, called now the umbilical vesicle, by a wide channel known as the vitalointestinal duct. So this is the vitalointestinal duct. This is the umbilical vesicle, but definitive yolk sac. This is the primitive gut. Right? Tarpor ki holo? At birth, this umbilical vesicle becomes small and almost disappear. These vitalointestinal duct also become cord-like and disappear. So this is closes. This is also closes, umbilical vesicle closes and disappear. Right? তার আগে যতক্ষণ ক্লোজ ছিল, এবার আরেকটু এখনো ক্লোজ হয়নি। এটা হচ্ছে গাট। This is the vitalointestinal duct. This is the cranial part. This is the caudal part of the primitive gut, and this is the middle part. Which is the middle part? Opposite the vitalointestinal duct. This area. This area is opposite the vitalointestinal duct, right? So, cranial part joins with the middle part here. We call, bhalo kore shono, anterior intestinal portal. The joining part where the same gut, come on, same gut. Dhoro, this is the gut, foregut. A passage join with this here, then it is continuous here. So this area, the joining part, we call the anterior intestinal portal. This area, this gate, we call posterior intestinal portal. Kono gate nei, just division, imaginary division. এইটাকে আমরা বলছি anterior intestinal portal. এইটাকে বলছি posterior intestinal portal. This is ultimately produce the buccopharyngeal membrane. So this part of the gut we call foregut. Foregut. This part of the gut we call hindgut. And this part, middle part, we call midgut. So anterior intestinal portal is the junction between the foregut and the midgut. Posterior intestinal portal is the junction between the midgut and the hindgut. And each gut has got its own artery, own blood vessel. Foregut is supplied by the celiac artery, midgut by the superior mesenteric, and hindgut by the inferior mesenteric artery. You will learn later on. So this way the gut is produced. Now the question is that, what is the other effect of folding? Ekta holo gut formation. Next, the most important, just imagine here, you put your hand here in this fashion. Your nail beds, you think it is the septum transversum, right? Anterior to cranial to caudal jacchi. This is the palm, বা বেটার টু সে যে ফিঙ্গারটা করো, ফিঙ্গার ইজ দ্য সেপ্টাম ট্রান্সভার্সাম, দিস ইজ দ্য পেরিকার্ডিয়াম, পেরিকার্ডিয়াল ক্যাভিটি, ওই যে আগের ছবিটা, এই যে এখানটায় septum transversum, pericardial cavity, then it is this ridge joint is the buccopharyngeal membrane, and here it is the neural tube, forebrain, midbrain, hindbrain, right? This forearm. এটা তাহলে কি হলো? septum transversum. Palm is the pericardial cavity. This joining ridge joint is the buccopharyngeal membrane. So initially septum transversum is the most cranial part, liver is the most part, liver. It is the cranial side, it is the caudal side. So liver is the most cranium. মাথার কাছে লিভার রয়েছে আমার। Followed by pericardium, heart. সুতরাং এখানে আমার লিভার, এখানে হার্ট। Followed by mouth, followed by the brain. তাই তো? হ্যাঁ, এটা যদি এরকম ভাবে রাখি, এটার থেকে কি হবে? সেপ্টাম ট্রান্সভার্সাম থেকে লিভার অ্যান্ড ডায়াফ্রাম, লিভার ধরে নাও। এটার থেকে কি হবে? হার্ট উইথ পেরিকার্ডিয়াল ক্যাভিটি। বাক্যোফেরেঞ্জিয়াল মেমব্রেন থেকে কি হবে? মাউথ, মাউথ হবে। তারপরে এটা হচ্ছে ব্রেন, এখান থেকে ব্রেন হচ্ছে। তাহলে যদি আমরা এভাবে, ইফ উই গিভ বার্থ ইন দিস ফ্যাশন, হোয়াট উইল হ্যাপেন? লিভার উইল বি দেয়ার, heart will be there, mouth will be there, and followed by the brain. Brain এখানে থাকবে। তাই কি হয়? হচ্ছে না? ডিউ টু ফোল্ডিং, দেখো যেই ফোল্ডিং করছে দেখো, ফিঙ্গার কোথায় চলে গেল? পেছনে, লিভার, followed by the palm, heart, followed by the buccopharyngeal membrane, আর এইটা সবার সামনে চলে এসেছে, ব্রেন সবার সামনে চলে এসেছে। দেখো, সো দিস ইজ দ্য বিউটি অফ দ্য হেড ফোল্ড। যেই ফোল্ডিং হলো, আমরা যদি এটাকে আর দেরি হয়ে যাবে, 1 ধরি, এটাকে 2 ধরি, এটাকে 3 ধরি, সাপোজ ইট ইজ এ 1, it is 2, it is 3, so due to folding 1 will come here, 2 will come here, 3 will come here, and this is the most cranial most. So this is the head fold which makes the septum transversum go caudally, pericardium followed by the pericardial cavity. So when we born, head is the most cranium, brain is the most cranial part, followed by the mouth, followed by the heart, followed by the liver, and this occurs due to head fold. And tail folded ফলে কি হচ্ছে? Cloacal membrane which ultimately produce the anal and the genital opening come here, and it is the 2 lateral folds. Ultimately they converge together. আরো খেলা আছে। তাহলে এটা হলো রাইট ল্যাটারাল ফোল্ড, এটা হলো লেফট ল্যাটারাল ফোল্ড, they try to come to close together. This is the umbilical vesicle, this is the gut, this is the umbilical vesicle, vitalointestinal duct, তাই তো? This is the primitive gut, cut section, লম্বালম্বি নয়, আমরা cut section করেছি, transverse section. So it is a cut section of the primitive gut, the cut section of the vitalointestinal duct, cut section of the umbilical vesicle or definitive Yolk sac. Ultimately, এখানে নেই ছবিটা, it will disappear and this right fold and left fold will continuous with each other. So intraembryonic coelom of the right half and intraembryonic coelom of the left half will continuous with each other, will continuous with each other. এই যে ফোল্ডিং হলো, হেড ফোল্ড, এইখানে septum transversum, pericardial cavity, mouth, and it is the hind brain. So brain is the most caudal side, and due to this folding, allantois will come here, cloaca is come here. এবার দেখো ল্যাটারাল ফোল্ডস এর খেলা, টু ল্যাটারাল ফোল্ডস হয়েছে, এটা বিউটিফুল পিকচার। এই যে প্রিমিটিভ গাট which is incorporated within the embryonic disc, this is the vital intestinal duct, it is the definitive Yolk sac or umbilical vesicle. দুটো ল্যাটারাল ফোল্ড এবার যাচ্ছে রাইট সাইডে, try to touch with each other, one another, each other. দুটো ল্যাটারাল ফোল্ড এরকম ভাবে কেটেছে এমব্রায়োকে, try to touch the right, try to touch the left side. The schematic diagram ওটা দেখেনি, এইটা পরে টাচ করে যাবে এন্ড কন্টিনিউয়াস হয়ে যাবে, পিকচারটা নেই জাগে। তাহলে আমরা এইটা শিখলাম, তাহলে কি হলো রিক্যাপিচুলেট করি। Changes occurs due to development of head fold, formation of foregut, buccopharyngeal membrane, pericardial sac and septum transverse come to lie ventral to the foregut, যেটা দেখালাম ছবিতে। Ultimately, longitudinal section, it is the foregut, it is the anterior intestinal posterior loop. This is the dorsal side, this is the ventral side, this is the cranial side, this is the caudal side. So, due to folding, buccopharyngeal membrane, pericardium and liver, septum transversum come to lie ventral side of the foregut. Dekho, this is the yellow is the foregut, come to lie ventral, and cranial most is the brain vesicle, which is covered by the head, skin and bones. And notochord and neural tube come to lie dorsal to the foregut and fourth brain vesicle like cranial to the foregut. Changes occurs due to development of tail fold, formation of hindgut, obviously, formation of allantoenteric diverticulum allantois, notochord and neural tube come to lie dorsal to the hindgut. Changes occurs to the development of two lateral folds, shifting of the amnioectodermal junction, pore bolchi, formation of midgut, vital intestinal duct, umbilical vesicle, formation of the dorsal mesentery of the gut and formation of the peritoneal cavity. পরে যখন আমরা স্পেশাল এমব্রায়োলজি পড়বো এখন বুঝতে পারবেন অনেক জায়গায়। এরপরে হচ্ছে জিস্ট, ইম্পর্টেন্ট ফর এমসিকিউ অ্যান্ড শর্ট কোশ্চেন্স। হোয়াট আর দ্য ডেরিভেটিভস অফ দ্য somatopleuric layer of the lateral plate mesoderm? Intraembryonic mesoderm has got a three parts: paraxial, intermediate and lateral plate mesoderm. Lateral plate mesoderm again divided by the intraembryonic coelom to the dorsal somatopleuric layer and ventral Splanchnopleuric layer of the intraembryonic mesoderm. From the somatopleuric layer develop the parietal layer of the peritoneal, pleural and pericardial cavities. I have already told you the peritoneal cavity, pericardial cavity and the pleural cavity has got two layers. One adherent to the viscera, we call the visceral layer, and one surrounding the viscera touching the body wall, we call it the parietal layer. Parietal means body wall. So, from the somatopleuric layer, parietal layer of the peritoneal, pleural and pericardial cavities develop. Pectoral and pelvic girdles, some bones will develop, but recently we are skeletal elements of the limbs. Not from the sclerotome of the paraxial mesoderm, our femur, our humerus. ভালো করে শোনো, from the paraxial mesoderm, from the sclerotome, paraxial mesoderm again divided into, আমি বারবার রিপিট করছি মনে থাকে জানো, dermomyotome and sclerotome. From the sclerotome develop the ribs and the vertebra. And the other bones, pelvic girdle, hip bone, scapula, etc. all develop from the somatopleuric layer. Not only that, femur, tibia, fibula, tarsal bones, humerus, radius, ulna, all develop from the somatopleuric layer of the lateral plate mesoderm, not from the paraxial mesoderm. মনে থাকবে? তাহলে ফিমার কোথা থেকে ডেভেলপ করছে? somatopleuric layer of the lateral plate mesoderm. Ulna কোথা থেকে ডেভেলপ করছে? Somatopleuric layer of the paraxial mesoderm. Vertebra কোথা থেকে ডেভেলপ করছে? Sclerotome. Ulna ডেভেলপ করছে Somatopleuric layer of the lateral plate mesoderm. But vertebra is developed from the, for example, lumbar vertebra developed from the sclerotome of the paraxial mesoderm. And এইবারে আরেকটা তখন বলিনি, ডার্মিস, ডার্মোমায়োটোমকে আমি কি বলেছিলাম? ডার্মিস অফ দ্য স্কিন ডেভেলপ। Yes, that's true, but partly true. Dermis of the anterior abdominal wall develops from the somatopleuric layer of the paraxial mesoderm. কি peculiar, কি ঝামেলা। Dermis কোথায় থাকে? স্কিনে। Epidermis, dermis. Dermis of the maximum part of our body, posterior body wall, posterior thoracic, are developed from the dermatome of the paraxial mesoderm. But the dermis of the anterior abdominal wall is developed from the lateral plate mesoderm, somatopleuric layer. And the facial dermis are developed from the neural cell. এটা লিখে রাখো, অনেক বইতে পাবে না। লাস্ট লাইনটা ইম্পর্টেন্ট ফর এমসিকিউ। Splanchnopleuric layer সবাই জানো, আগেই বলেছি। Visceral layer of the peritoneal, pleural and pericardial cavities and musculature of the connective tissue of the gut, respiratory tract and heart. Muscles, stomach muscles, intestinal muscles are developed from the Splanchnopleuric layer. Next আমরা মোটামুটি শেষ হয়ে গেল জেনারেল এমব্রিওলজি। সো hereby we ends the general embryology. Next chapter is a placenta. A question comes here in this year final examination. What is with a history, the abnormal bleeding, what will be your diagnosis, what are the different types of abnormal implantation of the placenta. সো প্ল্যাসেন্টা এবার এসে গেছে, তোমাদের আসার চান্সটা কম, তাও আসতে পারে। সো দ্য নেক্সট ইজ দ্য প্ল্যাসেন্টা। প্ল্যাসেন্টা বলার আগে আবার একটু রিক্যাপিচুলেট করব দ্য এমব্রিওলজি অফ দ্য ইনিশিয়াল সিস্টেম। অলরেডি ইউ নো this is the private yolk sac, this is the amniotic cavity, this is the epiblast, this is the hypoblast, right? And all is surrounded by এই জায়গাটা Splanchnopleuric layer of the extraembryonic mesoderm. And there is cavity which is called extraembryonic coelom. Outside this extraembryonic coelom, there is somatopleuric layer, this reddish area, somatopleuric layer of the extraembryonic mesoderm, right? So আমরা যদি এখান থেকে এখানে যাই, lining wall Husser's membrane of the yolk sac, Splanchnopleuric layer of the extraembryonic mesoderm, extraembryonic coelom, then somatopleuric layer of the extraembryonic mesoderm, then there is a cytotrophoblast where the cell margins are distinctly seen with nuclei. Each cell can be seen distinctly, and outside it there is an syncytotrophoblast, and this is the uterine endometrium. Here is the basic stroma and some cells are present. It is the uterine endothelium with the defect is closed by the fibrin plug. মনে পড়ছে কি? হ্যাঁ? Is the blastocyst enters within the endometrium. Uterus has got a 3 layers, perimetrium, myometrium and endometrium. Endometrium has got a 3 stratas, stratum basalis, stratum spongiosum and stratum compactum. And this blastocyst enters the stratum compactum outside it, and this is the endometrium. Loosely I am speaking endometrium, mainly the stratum compactum, and ekhane royeche stratum basalis. This stratum compactum containing stroma means মূল স্ট্রাকচারটাকে আমরা স্ট্রমা বলি, বলেছিলাম হোয়াট ইজ স্ট্রমা, হোয়াট ইজ প্যারেনকাইমা, অ্যান্ড দেয়ার আর সার্টেন সেলস, রাইট? এই ঢুকে গেছে, একদম ঢুকে গেছে ব্লাস্টোসিস ইউটেরাইন এন্ডোমেট্রিয়ামে at about day 11-12, এবং সাইড বাই সাইড বাইলেমিনার জাম ডিস্ক হয়েছে, hypoblast and epiblast, a cavity formed which is lined by a epiblast cell called amnion cell, we call the amniotic cavity, and from here the Hughes membrane covered this blastocele cavity, converted into the yolk sac, and outside it there is an cytotrophoblast, but a mesoderm will appear which is called the extraembryonic mesoderm, and within this extraembryonic mesoderm a cavity will appear, which in surrounding cavities appear all region except here, which will ultimately produce the connecting stalk and the umbilical or next future umbilical cord, and these cavities separate this extraembryonic mesoderm into a Splanchnopleuric layer and Somatopleuric layer. This is the cytotrophoblast. Cytotrophoblast rapidly divides to form the syncytotrophoblast, which has got a eroding property, adhesive property, touch korche, erode korche, and it erodes the blood vessels of the uterine stroma. And now uterine stroma, certain due to hormone produced progesterone and human chorionic gonadotropin, the uterine stroma has got some changes occurs. The cells are swollen, the cells produce and contain glycogen and lipids, full of nutrition. We call them decidual cells, and nowadays we will call the uterine endometrium as a decidua, mainly the stratum compactum and stratum part of stratum submucosum. We call them decidua, right? এটা একটা শিখলাম। তাহলে আমরা কি বলছি, uterine endometrium after pregnancy which changes into decidua. এখন থেকে আর endometrium বলবো না, আমরা decidua বলবো, রাইট? অ্যান্ড আমরা আরেকটা কি জানলাম, জেনেছি, যেখানে this is the whole blastocyst going to be, right, and the in one end of this circular body the embryo is going to develop. খুব ভালো করে শোনো এটা। At one end of the, though it is a circle, globular, spherical, at one end the embryo is going to develop. We call this end embryonic pole, like North Pole, South Pole, we call it embryonic pole. Rest of the area of this embryonic, this blastocyst cavity or conceptus, we called embryonic pole. That is very important now. Embryonic pole and embryonic pole. And this embryonic pole is covered by, bhalo kore shono eta, is covered by cytotrophoblast and syncytotrophoblast. But due to some hormonal effect, these area, the embryonic pole, cytotrophoblast and mainly the syncytotrophoblast grows more like a tree, and produce tree like corion. কি কোরিয়ন আমি আসছি, বলেছি একবার, আবার আসবো, কোরিয়ন. And these embryonic pole, the cytotrophoblast is very thin, not proliferating, not growing. Syncytotrophoblast is very thin, not proliferating, not growing. So this embryonic pole, which ultimately will grow faster, we call it chorionic frondosome. Chorionic frondosome. এবং অ্যাবএমব্রিয়নিক বলে যেখানে কোরিয়ন ভালো ডেভেলপ করেনি, তাকে বলবো কোরিয়নিক লিভি। কোরিয়নিক লিভি। আবার আসবো আমি, কারণ দরকার নেই, এমব্রিও তো ওদিকে আছে। সো হিয়ার দ্য চেঞ্জেস অকার মেইনলি হিয়ার, উই কল ইট কোরিয়নিক ফ্রন্ডোসাম, এবং এখানে উই বল দ্য কোরিয়নিক লিভি, রাইট? Look beautifully. Here the syncyto and cytotrophoblast grows in this fashion like a tree, more, and এইখানে কোনো গ্রোথই নেই। সুতরাং এইটাকে আমরা বলবো কোরিয়নিক ফ্রন্ডোসাম, এইটাকে বলবো কোরিয়নিক লিভি। এইটা হচ্ছে এমব্রিও, আর এটা হচ্ছে এক্সট্রা এমব্রিয়নিক সিলোম, সো লার্জ, থাকবে না। যখন বার্থ হবে একটাই ক্যাভিটি থাকবে, সেটা হচ্ছে অ্যামনিওটিক ক্যাভিটি। এত বড় এখন, আলটিমেটলি ফিনিশড। এরপরে আমরা আসছি কোরিয়ন। দিস ইজ দ্য এপিব্লাস্ট, হাইপোব্লাস্ট, হিউজাস মেমব্রেন, ইয়ক স্যাক, অ্যামনিওটিক ক্যাভিটি। দিস ইজ দ্য ট্রোফোব্লাস্ট। ইন বিটুইন দিস অ্যামনিওটিক সেল অ্যান্ড দিস হিউজাস মেমব্রেন, রেড কালার এখানে দেখাচ্ছে, ইট ইজ শোয়িং রেড, এ মেসোডার্ম ইজ ডেভেলপ। And this is the trophoblast. This is the trophoblast, black. This black is the trophoblast. So mesoderm is developed. We call it extraembryonic mesoderm. Now a cavity will develop within this extraembryonic mesoderm, which separates the extraembryonic mesoderm into a Splanchnopleuric layer and a Somatopleuric layer, except in the caudal area, which will ultimately produce the connecting stalk or umbilical cord later. সব জায়গাতে সেপারেট করেছে, দেখো extraembryonic mesoderm bed due to formation of this placenty. It is the, এই জায়গাটাকে বলছি আমরা Splanchnopleuric layer of the extraembryonic mesoderm, আর এই লেয়ারটাকে অফ মেসোডার্মকে বলছি Somatopleuric layer of the mesoderm, which is outside blue color trophoblast, which will ultimately produce the cyto and syncytotrophoblast. তাই তো? এখন আমরা এই, এটা কাট সেকশন, কিন্তু অ্যাকচুয়ালি ফিগারে এরকম মেমব্রেনের মতো, and this membrane with the somatopleuric layer of the extraembryonic mesoderm and the trophoblast, we call it কোরিয়ন। এই মেমব্রেনটাকে আমরা বলি কোরিয়ন। So কোরিয়ন is equal to somatopleuric layer of the extraembryonic mesoderm and trophoblast, cytotrophoblast and syncytotrophoblast, mainly cyto, তাকে আমরা বলছি কোরিয়ন। কি বলছি? কোরিয়ন। আর এখানে অ্যামনিওজেনিক সেল আর এক্সট্রাএমব্রিয়নিক মেসোডার্ম, এইটাকে বলছি আমরা অ্যামনিয়ন। এইটাকে আমরা বলি অ্যামনিয়ন।